Hey there! Thank you so much for your interest in Home-based Balance Rehab, a review of the literature. In this video, I'm going to go over a little bit of an overview so you know what to expect if you come to one of our courses or if you take the webinar version. So in the beginning of the course, we do go over the relationship between the sensory input and motor output that is involved in all of us balancing, being able to balance. So we break it down into talking about what components of vision, vestibular, and somatosensory systems take part in balance and how they work together in order to inform what kind of motor output is needed for that specific situation that your body is gathering the sensory information for. We talk about all of those things in relation to motor learning and how it all is intertwined and how you can get the best results by breaking down exactly where the impairments lie so that your treatment isn't just a one-size-fits-all kind of deal. So you can identify where the impairment is and then pick the treatment based on that so that it can be the most specific to your patient as possible. We also talk about fall risk factors. That's both internal risk factors. So again, if there's a breakdown somewhere in the sensory system or a breakdown in the motor learning process, and also environmental risk factors. And again, we show you how you can identify what risk factors are present, but then not only identify them, it will show you how to also go down the correct path based on what the research says is the most appropriate intervention to do for those risk factors that are present. And then a lot of the literature that we talk about in this course is related to the interventions that we chose to dive a little bit more into for the home care setting. But don't be fooled. A lot of these interventions can be generalized to all settings. So if you work in acute care, outpatient, rehab, you can still use these principles. The interventions are yoga, video games, walking program, and then the incorporation of cognitive therapy into your other tasks, so a dual tasking kind of situation. So we really dive into what the most current literature says about each of those four topics, and we talk about how you can really take whatever the resources are available to your patients and the patient's family and really get them going with a program of the nature of yoga, video games, walking program, or just incorporating cognitive therapy into their regular interventions that you would normally do. So please check it out if you have an interest and stay tuned for more information.